And welcome back. Dental implants are a proven replacement for decayed, broken, or missing teeth. But what might be right for some may not be for others.
And joining us now to talk about it is Dr. Ahmad Eslami with Dental Implant and Periodontal Solutions. Welcome to the show. Nice
Thanks
to have
for being
you.
Here.
Good morning. Thank you very much. It's my pleasure.
I think this is important to talk about. First, just what are dental implants? Because a lot of people think you either have your teeth or you have dentures, and there are a lot of things in between.
Oh, definitely. Dental implant is really a replacement for the root of a missing tooth or a tooth that is broken and is about to be lost. I have a model. I can show it to you.
Okay.
Here.
I'll hold it up a little higher.
Yep.
Sure, sorry. So
Yep.
here's a model of a missing tooth, and dental implant basically replaces the root.
Okay.
And so it goes into the bone where the root was, where the tooth was, and obviously it takes some time for the implant and bone to integrate together, and then later on
I think it fell down. I think I heard the pin
thing,
fall
yeah.
down.
Okay.
a post is going to be placed on the implant and then a crown.
Okay.
So if a
Okay.
patient, often patient come and try to show me their implant, you cannot see the implant. Implant is in the jawbone, so it requires two other parts in order to complete the case.
Who's a good candidate for it? Can anyone get an implant?
Yes, implant is for everyone. Anyone who has a missing tooth, decayed, broken tooth, or they have been missing their teeth for a long time, they can get dental implant. It's the best replacement for a missing tooth. It's a one-tooth solution to one-tooth problem, as opposed to bridge, which is a different way of doing it. When you're missing a tooth and get a bridge, it involves 3 teeth in order to replace one tooth.
Yeah, these before and after pictures that we were just looking at are incredible. The difference that people can smile again.
Definitely. Actually, really one of my mission has been for the past many years to really bring health and smile and confidence to people. And all these cases that we see, they all have had those issues, and they just could not be any happier.
Yeah.
Do you think it works for any age? I mean, can somebody who's young or someone who's old have implants?
It is for all ages, except, in fact, there is no upper limit. That means,
Okay.
you know, we cannot say if you're 80, then you're not a candidate. In fact, I've done implant for a 92-year-old person.
Wow.
You know, very bright lady, and she's just full of life. However, at the front end, it is really not recommended for children and young adults until about age 17 and 18,
Okay.
because they're still in the growth phase and face and mouth changes, so the implant may not be quite in the right place.
Many people like me have sort of a strong gag reflex.
Yes.
Like when you put in molds to make
Sure.
teeth. What about people who say, I'm a gagger, can I still do the dental implants?
Most definitely. That is probably their best friend, because when you're a gagger, in fact, I had a patient that he could not even brush his teeth, you know, from inside. Oh, you're
It's
one of
me.
those?
I know we're looking at it.
Yeah.
I'm like, I have a gag reflex to toothpaste, you know?
Well, talk to me, because I
Yeah.
have some solution for
Okay.
you. So once a patient is missing their teeth, really the best option was available was to get a denture. And as you see, it's full of plastic in the mouth, and this part really creates a high gag reflex. With dental implant, first of all, we can stabilize the denture so it won't move, and or actually make it into a palateless denture for those patients. So there is no part that triggers a gag reflex, which is toward the back of the throat. And then, of course, from there, we can even go to another way of doing it, which is very much just
wow.
like natural teeth. Very
You
much-
can see the implants right in there.
Yes, the implants are in the jawbone, and then the denture will be, actually it is really more of a bridge. It will be placed on it permanently, and then it is actually screwed on top of the implant, so they don't take it out.
Can you take those out yourself, or does a dentist take that out?
The other ones, you can take them out, but these are called fixed detachable.
Okay.
That means they're fixed from your concern. In fact, one of those pictures I had sent here had that, and but we can take them out every so often. What I call for an underbody flush. Once in a while, we take them out to
Clean
clean
it
them
out.
out. Yes.
Real quickly, if you have a loose tooth, can you have a dental implant immediately placed?
Most definitely, yes.
Okay.
There are some ideas that no, it cannot be done, but it has been one of my traits I have been doing. Take the tooth out, place an implant, and place often a temporary crown for the front
And quickly, you also treat probably a lot of sports injuries because people get teeth knocked out.
I hope they show that picture, yes, you know, especially in kids who are in sports and break their teeth. There's a very gross picture here that the tooth was a sport injury, and we took the tooth out immediately. It was really a Saturday afternoon. They called me in panic, took the tooth out, placed implant and a temporary crown on it immediately, and it was
fantastic.
back to his job.
Teeth
Thank
and
you
good
so much.
smiles change people's lives. I know you do a free monthly dental implant seminar, so if you've been told before you're not a candidate, you should go in and see the doctor. The Dental Implant and Periodontal Solutions office is located on 109th Street, Suite 275 in West Allis. You can call the phone number on your screen or visit them online at teamperio.com for more information. Thanks for being here, doctor.
Oh, it's my pleasure. I would like to come back here and talk more about it, also talk about periodontal disease, which is really one other passion of mine, which is really creating quite a bit of buzz in the community.
We love that.
Absolutely.
Thank you.
Thank
Nice
you
to
very
meet
much.
you. It was a pleasure.
My
Thank you.
pleasure.